All right, we are ready to start. Hello and a very warm welcome to everyone who's attending our webinar that we will hold together with the mammography clinic at Karolinska University Hospital in Stockholm, Sweden. My name is Elisa Muzzi, and there are two speakers with me today to talk about language barriers and how to reduce them within mammography. We're very excited to have Rosemary Linkvist Vikander with us today, representing the clinic and telling us about their experience of using Care to Translate. In situations such as screenings, we know that time is scarce, and at the same time, screenings can be frightening and a source of concern for the patient. Being able to communicate and instruct the patient in their native language can foster a more empathetic relationship with the patient, but also speed up the process, benefiting both the patient and the healthcare provider. To tell us more about how exactly the app can be used, we also have our CTO and co-founder, Alexander Gillensvart, with us today. But first, let's take a look at today's agenda. We will start with a brief introduction about Care to Translate, followed by a quick demo of our app. We will also look at how the app can be used in mammography and explore the case study of how the app is used in the mammography department at Karolinska University Hospital. I would like to let you know that if you want to ask questions, you can do so in our chat throughout the presentation. And after the presentation, we will open up for a Q&A session where you have the possibility to get your questions and comments answered by your experts. You will also be able to unmute yourself and ask your questions verbally if you'd like to do so instead of using the chat. We also have a special offer for those of you attending today, and we will hear more about that later. And now it is time for Alex to tell us more about Care to Translate and how it can be used in mammography.
Hello, everyone, and thank you for the introduction, Eliza. So once again, I'm Alex, and I'm one of the co-founders of Care to Translate, and I'm the CTO. So I will just give you a brief introduction into what Care to Translate is and how we try to solve language barriers in healthcare. So first of all, Care to Translate is a medical translator for healthcare professionals and for patients. This means that we have over 3,000 phrases that are verified by native speakers with medical expertise that can be used on mobile, tablet, and desktop. They're available in 45 languages. It's both online and offline, and it's 24/7, which means that you have access to it any time of the day. You can use Care to Translate in many situations where you maybe typically don't have access to a human interpreter, which we know people don't have all the time. To look at the mammography patient journey, these are some examples of where you can use our app to help communication with patients. So for example, when you register the patient in the reception, you can use our app to help them through the registration process. You can use it to ask important questions to ensure patient safety before going into an examination. You can also use it to talk to the patient during the examination. You can use it to inform and calm the patient during the entire stay. And you can also use it to give information just before discharge. Care to Translate is based on a set of phrase lists that are customized to your specific needs. So we do have ready-made templates that you can get started with really quickly that are done for different clinics in different parts of the hospital environment. And of course, there are templates made for mammography that you can use in the beginning. Then you can easily edit and base it on your specific needs at your clinic or your department. And you can share these lists with your colleagues, with the whole department, so you can ensure consistent communication even when there's language barriers present. And to show you how this works, I think we'll do a quick demo of the app because I think that's the best way to get an idea of what we do. So I'm just going to switch what I'm sharing. And now I hope all of you see the app. So when you get into our app, you get to choose if you want to use it as a patient or a healthcare provider. And in this case, I want to use it as a healthcare provider. I'm going to select the patient language. So in this case, maybe the patient speaks German, which I can't speak, and some languages are made in a way that they change depending on the target gender. So then you get to select if the patient is addressed as male or female. If you have an account, you can sign in here. If you don't have an account, you can try using the app without an account and have a free experience. But using the app with an account, you can get access to specific clinic templates. This is our organization where we have different accounts for many different types of clinics, and we will look at the one called mammography. So when you get into the app, you see that you have these ready-made playlists at the top that are used in mammography or for mammography. You have some general playlists like app info or interpreter info or payment info, where you can just inform about these regular flows in healthcare. But you also have specific lists like interview for mammography or examination. If we go into one of these lists, you will see that in the beginning, we have some just good to have phrases where you can say that you don't speak their language, that you will use this device to ask questions. And you can also instruct the patient to nod their head for yes and to shake their head for no. Because all of our phrases are made in a way so you can always answer by just saying yes or no. And if there are other types of answers, then you have alternatives that the patient can press. So we help you communicate in a way that makes it easy for the patient to answer your questions. If you press any of these phrases, for example, have you been through this type of procedure before?
Haben Sie diese Art von Behandlung schon einmal gemacht?
Now, I'm not sure if you heard the sound or not, but if you did, it plays in German. So then the patient can either nod or shake their head to respond, or they can press any of these alternatives, and the answer will be played back to you. If you want to switch the language, you can quickly access the languages up there, and you can go in here and choose, for example, Danish, which is a non-gendered language, so you don't have to choose the gender. You can play the same phrase,
denne type af undersøgelse eller behandling før?
but now it's in Danish instead. After going through a list, you can quickly go to the next part of your flow, for example, examination, and then you can have phrases that are for that part of the process instead. So here we have some phrases for examination where you can guide the patient through the process. If you need a specific type of phrase that is not included in any of the lists, you can always just search for the thing you're looking for. So for example, if you want to talk about if it hurts, you can search for hurt and you have phrases like, does this hurt? It hurts a lot. This might hurt. Does it hurt here? Etc. You can also search for phrases like worry if you want to calm the patient. So for example, say, do not worry, or asking them if they are worried and also saying that you understand they are worried. So this is a small example of how you can use Care Translate. We have also just recently started implementing image support to make it even easier to explain to the patient how what you're trying to say.
Nik venligst for ja, og ryst på hovedet for nej.
So for example, with this phrase, you can also see an image that explains what we mean with the phrase, if it's unclear. So that's it for the demo. I'm gonna head back to the meeting and change presentation again. Okay, so we're back at the presentation. And now I want to remind everyone that we have an offer connected to this webinar. So we offer a 2-month free trial for mammography departments, and that's followed by 50% license discount for an entire year. This means that you can explore risk-free and try it out, and you can gain insights to see how Care Translate could be used in your department. And note that this is only valid until 17th of May. So if you're interested, don't hesitate to reach out to info@caretranslate.com. And to wrap up the need in mammography, you can use Care Translate throughout the patient journey, as we've been talking about. So you can use it pre-screening to explain the procedure. You can use it during screening to provide instructions and give information and enhance the understanding and compliance to the patient. And after the screening, you can give instructions on how they will receive the result, for example. In all of these steps, it gives increased comfort and reduced stress for both the patient and also the healthcare professional. And then, before handing it back to Elisa and to do our interview, as the CTO at Translate, I feel obliged to talk about this topic because AI is something that everyone talks about nowadays. So why not use machine translation? First of all, you should use all tools that you have available when you don't have an interpreter. You should make sure that you're doing your best to make the patient understand the information, and that might be using machine translation. But it's very important to know the issues and what you need to look out for when using machine translation. First of all, there are inaccurate translations. No matter how good machine translation gets, there's no possibility for it to be correct all of the time. So you have to know that sometimes it is inaccurate, and since you never speak the same language as the patient, you will never know when that inaccuracy happens. And this is a big risk. And it might work if you're a tourist trying to talk to a local at a cafe, but in a healthcare setting where you absolutely need to get the correct answer from the patient, it just is too big of a risk. Then there's lack of data in minor languages. So of course, all the big languages work very, very well with machine translation. But when you look at minor or just smaller languages, there's a big lack of data, meaning the models are just not good enough. These can be minority languages, such as the Sami languages that is spoken in the northern parts of Sweden, Norway, Finland, and Russia. But it can also be pretty big languages, such as Dari, that is spoken in by over 10 million people in Afghanistan. We have those languages in our app, and we have the ability to customize based on our customers' need, because we're not dependent on data in the same way. It is hard to write good prompts, and that is something that I want to talk about, because with AI, and anyone who's using a chatbot knows now, the result is only good depending on how good the prompt is. And it's hard to write good prompts. This is the same for machine translation. Even if the translation itself is per se correct, if you don't know how the other person talks about this thing, it can be a cultural difference or a contextual difference, then it's impossible for you to know what to input. And then it doesn't matter how good the machine translation is, because the input might be wrong. And that's a big thing to take care of as the healthcare professional. It's a big responsibility. And then last but not least, data protection is also something that is talked a lot about within healthcare. We need to protect the patient data, and we need to make sure that it's not processed where we don't want it to be. And most machine translation services are based in the cloud. And this means that whenever you input something, to process that and to translate it, you have to go through a cloud service, meaning that you send the data input to a service that you not necessarily have a contract with or that you don't have control over. There are certain models that run locally on a device, but they're much less accurate, which means that you increase the risk of inaccurate translations. This is the few of the points. Why not use machine translation in healthcare? But I really wanted to share it. That's the final thing I have, and I'll be back at the Q&A. So now I hand it back to Elisa for the interview.
Thank you very much, Alex. If the audience has questions for Alex on any of the topics he covered, such as machine translation or the app's functionalities, please make sure to add them to the chat, and we will soon be able to answer them. But now it's time for our guest speaker. I would like to welcome Rosemary Lindqvist Vikander, who is joining us today to give us insights on how the app is used in her daily work at the mammography department at Karolinska University Hospital. We are very happy that you made the time to join us today. And we can start off with the first question. Can you please tell us a bit about your background and your role at Karolinska University Hospital?
Yes, thank you for the introduction. Yes, I have been working as a X-ray nurse for 31 years, and I have been working at Karolinska for about 6 years. So I work there as a team leader, and I manage the invitation for the screening program here at Karolinska. So it's about 60,000 invites per year. That's what I do.
Nice. Thank you. Thank you for the introduction. I would like to know a bit about your experience with language barriers in mammography settings. How do language barriers impact patient care and safety throughout the patient pathway within your area of expertise?
Well, it's important that she understands what she's going to do and what she's going through, and why mammography is life-saving, and it's important to participate. And if she understands, she might come from another country who doesn't have this kind of screening program. So it's a bit of so it's very important that we have that kind of communication. And when we can speak in her language or ask her, she will understand why.
Thank you very much. And my next question is about the implementation of Care to Translate. What motivated the mammography clinic at Karolinska University Hospital to integrate Care to Translate into its healthcare practices?
Well, when you invite women to the Swedish program, you only get the personal number, so you don't know where she comes from. So she might have arrived for a couple of months ago. She doesn't speak the language. So it's easy to use, and they are only scheduled for about 5 minutes, so we don't have that much time. And if we can, we like to avoid to have a relative or another person in the examination room. So it's so easy to use. And the image quality is vital here in this examination. So when she understands, she knows she can relax and participate as we like.
Great, thank you. Now, we know that patients feel cared for and understood when instructions are provided in their own language. Can you please discuss how this enhanced sense of safety and comfort contributes to the overall patient experience at the clinic?
Yes, well, when you work with the mammography, it's the quality of the pictures that is everything. And when she understands, she can relax and you get a better picture, and she will participate again. So we always talk about the quality, and when she understands, she can relax and she's not so tense, and she can answer the right questions. So we only ask yes or no questions. So.
Thank you. And I have a follow-up question.
Yes.
You partially answered already, but if you can please expand on it. Have you noticed any changes in patient cooperation due to the smoother experience provided by the app?
Yes, she will feel as she is seen, since we make an effort to communicate as best as we can. And sometimes they feel it's not so fun to have someone else with them in the room, because if you come from a country where you're not used to take off your clothes in front of strangers, it's easier to ask them when they feel comfortable. So then again, yeah.
Great, thank you. And you also mentioned relatives. Why do you want to avoid relatives, family members, to translate in a mammography setting?
Uh, some women bring their children, and children doesn't know the right words for the examination. I don't think a teenager know what estrogen or whatever it is, and perhaps the mother doesn't want to tell the child or sister if she have ever had surgery for perhaps cosmetic reason or whatever. So it's a bit of a privacy.
Absolutely. Thank you. And how does this contribute to ensuring safer procedures then?
Well, then again, I'm to the theme of quality of the pictures, because if you manage to get a good picture from the start, you will reduce the risk for supplementary pictures that you have to recall the women. And that is always very stressful for women to be recalled, because they always think that they have cancer, not a bad picture. So.
Thank you. And could you please share a specific success story or a positive outcome resulting from the use of Care to Translate at your hospital?
I don't have a really specific story, but I'd like to say overall we are very pleased with the app because then again the women feels like we are really trying hard and they know when to get the answer from the examination and what is happening and why it's so important to participate in the Swedish screening program. So and the feedback is that they thank us for using the app so they understand.
That's nice to hear. And in case we have someone listening today who is maybe interested in trying Care to Translate in their organization, can you recommend examples of best practices for integrating Care to Translate into daily workflows in mammography operations?
Yes, you can use it on a clinical patient and in the screening because you can't say from the name where she is if she does speak Swedish or not. And if she's on a referral, it doesn't always say that she needs an interpreter. So it's easy to use the app and you get the questions very fast. So and answers fast. So, and I'd like to add something else that I have. A colleague, she has never gone to Swedish school. She's not brought up here, but she speaks perfect Swedish, but not English. So she can use the app as well because she's not so comfortable speaking English with the patients. So it's a good use in the other direction as well.
Absolutely. Thank you. And is there anything else you would like to share with the audience today before we open up for questions?
No, I think I covered it all.
Great. Thank you so much. Thank you for giving us and the audience insights into your daily work and challenges, but also on how you try to overcome language barriers with our app. And now I would like to open it up for our audience to ask questions. You can write them in the chat. I see that there are a few there already, and we'll get to them soon. But you can also raise your hand if you would like to speak instead. And make sure to ask them now that we have our experts here to answer them. So the first question was, is it possible to enter free text? And I'm going to ask Alex to answer the question.
Yes. So short answer is no. You cannot enter free text. This is part of the design for the app. So when entering free text, we get into the things that I talked about with machine translation, where you can't verify that whatever you inputted is actually giving the correct output. So what we do is that we have specific phrases because that allows us to control them, and we can control the whole library, which can give the users a sense of trusting what is the output. So you don't have to just hope that it's correct. You can actually know. And that also means that whenever we find a phrase that isn't correct, because we're humans too, we can make mistakes, but then we can correct them. Like that's the main difference. Then we can correct those mistakes and they will be correct in the future. So we don't use free text, and that's part of the solution.
Great, thank you. And what if a patient wants to ask about a specific subject, for example, hurt? Would they be able to use the device and the health professional hears the question?
Yeah, it's a bit tricky to know like how to answer, but what I can say is that we have a patient version of the app, and that is free for anyone in the world to download and use. Like the app is actually being used by, I think it has been downloaded by at least 300,000 patients around the world, and they can use the app to communicate their symptoms. But since all phrases are formulated in a way that makes it really easy to answer just yes and no, it means that you as a healthcare professional, you don't really need these longer explanations from the patient, but rather you can focus on what's important for you to get answers to. So you won't have like a flowing dialogue, but you will have a very good protocol to follow, even if you can't speak the same language. Yeah, I'm not sure if Rosemary want to add anything about have patients needed to use the app anything in your experience? Like, have you ever needed to hand it over to the patient?
No.
No.
Because it's yes and no questions. So you sort of lead them through the examination physically.
Yeah, thank you.
Great, thank you. And we have another question. Can the app be utilized by an individual for interpretation outside the healthcare industry? And maybe Alex can take that as well, please.
We are experts in a medical environment. That's where we come from. That's our whole idea, and that's what we're trying to achieve. We're trying to achieve communication within healthcare. So the app is supposed to be used within healthcare, and that's where we have experts, and we believe that the expertise is what makes us strong. So no is the short answer outside of the healthcare industry, but there are many different parts of healthcare that it can be used within. So you can use it within elderly care, that is one part of it, but also mammography, which is those two are very different when it comes to how you use the app, but you can use it in multiple environments within healthcare.
Thank you. And someone else is asking whether the app is AI integrated.
I'm almost gonna ask if you want to try to answer that one, but no. So when we talk about AI, there's so many different things. It's a very broad concept, but the core of the product, which is the translations, that's not AI. We of course use modern technologies to work with translations, but the important thing is that we have the human reviewers and we actually make sure that it's correct. Then when it comes to other parts of the app, of course we use AI, like the sound that was played. We use AI to make sure that the sound quality is good throughout the phrase library. In the beginning, we used humans to record phrases as well, but then the quality of the sound fluctuated a lot, which meant that it was some phrases could be really high, some phrases could be low, and it was hard to maintain a good quality. And their AI is used to make sure that all sound is equally good. So AI integrated, I'm not sure, but we use it, but it's not the core.
Great, thank you. And someone is asking about whether the app can be used in other languages other than English. And I can quickly say that the app is available in 45 languages, and the app can be used in any of those languages. So that can also be good to know. Someone else is asking, in some settings, there is a fixed amount of time allocated to mammography screening, I guess. In your experience, how much extra time do you need with a person who does not speak the local language? And maybe Rosemary can tell us a little bit about that.
I think it's about the same time as a first timer. When you do mammography the first time when you turn 40, it takes a few minutes longer because you have to do some more explaining. So I say it's the same time as a first timer. So it doesn't take that much longer.
Great, thank you. Someone else is asking about the cost implication if they need to use the app as an individual, especially as a non-Swedish speaking individual.
Should I answer that one?
Yes, please.
So the tool is of course best utilized by having it on a whole clinic, because then you can share your lists and you can make sure that you maintain the same structure for everyone who works within that clinic. But there is, as I said before, a free version of the app, first of all, that you can use as a healthcare professional as well. It's a bit limited though. So you can purchase a premium subscription as an individual. So that's cheaper, of course, than for a clinic. And then you can create your own lists and you can customize it and use it for your needs. So that's the way to use it as an individual if you want to. Download it and try. It's easy.
Yes, and we'll show a QR code later so that everyone who's interested can download the app and try it for free. Then we have a question for Rosemary. Who were the key players in your organization when introducing the app, and how many people were involved in the implementation?
We were, well, she's not here, the key person, but we were 4 people, but then it's so easy to use. It's like if you use Spotify, you can use it. So it's very easy. So it was very easy to learn. So it didn't take that much long time. And since we're all X-ray nurses, we're a bit technical. So I don't know. So it was easy.
Great, thank you. And someone is asking if you use a telephone or iPad to ask the questions.
We use telephones because we don't have iPads. So.
And then maybe Alex can take this question. In case someone buys the license, can several devices use the app in the same department?
If I understand it correctly, the answer is yes. So if you purchase the app for a department, then you can use it on a certain amount of devices in that department, depending on a bit on the plan you're on. But yeah, you can use the multiple devices, and we can always make it work if you have many individual devices as well.
And then we have a similar question. I don't know if we have any recommendations on this, but how many telephones would you need in a department?
Yes, I think this is depending, of course, on what type of department it is. As Rosemary said, you're using phones. I'm not sure if is that working phones that you get from the department, or is it your private ones?
No, it's from the department. And it's not so often you have to use it at the same time. So it works, yeah.
Yeah, because we have found like different ways of implementing it, where some are very technical and everyone have their own mobile phone. But in clinics where maybe all the employees doesn't have that, there are ways to, for example, buy shared tablets. And then you can have those tablets at crucial locations in your department. So for example, in the reception, you can have a tablet that you share across the organization. So there are a couple of different ways of implementing it, and I think it's best to just talk about how it would best suit your department.
Thank you. And I have a question for Rosemary. What is something you have learned from this experience of implementing the Care to Translate app?
Well, that it is much easier because when we didn't have it, we had to use Google Translate, and the patients use Google Translate, and we didn't talk about the same thing. And they told us that they didn't like it because it said the wrong words. So I think it's easier because you don't have to manage the patient so firmly with her body. She knows how to follow in the examination. So that's, I think, is you have a happy person in front of you. That's important.
Great. Thank you for sharing. We have one more question. If the app is purchased for an entire clinic, is it only mammography specific, or can it also be used for X-ray, bone density, ultrasound? Alex, would you answer that, please?
Yeah, so there are multiple ways of using it, and I think the best way would be to reach out to us and get a demo, and then we can talk more about the details. But you can, of course, use it throughout multiple different clinics, and you can set it up in different ways to either share lists for each specific clinic or department, or just have everything in one account. So there are different ways of having it used in different departments. But I think it's better to like see a live demo and talk to us in detail about your needs to know more.
Great, thank you. And I have another question. What do you need in the department to implement the app?
Yeah, you only need a device. That's basically what you need. You need a device, and you need healthcare professionals who want to help the patient. because I think that's the biggest thing, to implement it and start using it. It's very easy to get started. So it's more about getting the behavior in rather than any, I don't know, technical dependencies or anything like that.
Great, thank you. And then we have another question. One barrier accessing screenings is that some women who do not speak the local language do not understand the invitation, letter, brochure, documentation. Have you done something to address this problem? Alex, would you go ahead and...
Yeah, I would like to hear Rosemary's perspective first.
Yeah, because we don't manage the screening invitation. That is national. So unfortunately, we don't, here in Stockholm, we don't have a QR code so you can scan. That is something on our wish list. So no, I'm sorry, it's not in our hands. So we'd love to have it, but
yeah, and we haven't done anything regarding like those types of translations yet, but we do help other companies with healthcare translations in general. So we're trying to help other companies being better as well at these types of flows, but we don't have any service for exactly those type of things, like the invitation or that.
Great, thank you. Any final questions from our audience? You can unmute yourself and ask them verbally if you'd like. Anything else our speakers would like to share before we wrap up?
I feel like I have one last question for Rosemary, because I'm curious about what I mentioned during my presentation about using the tool to not only communicate and make sure that it's correct, but also to kind of structure the process to not have, for example, stress causing you to forget about something because you're trying to communicate. Have you seen like any benefits of having those type of structured lists that you kind of have to follow when you use the app?
no, because when you work with screening, it is very, you ask every woman the same question. So it's the same. It's just that you push and you have it in another language. So you always, because we have to fill it in for the doctors who view the pictures later on. So the question is for the doctors. So we have to ask them, and it's otherwise they will come knocking on our shoulders and why did you ask the patient that? So.
Okay, I see. So it's still a good way to follow the structure.
Yes.
That you have to follow.
Yeah, correct.
Great, thank you very much. Then I think it's time for us to wrap up. I would like to thank our speakers again, Rosemary and Alex, for being here with us today and sharing valuable insights into how to overcome language barriers in mammography. And thank you so much, everyone in the audience as well, for joining us today and for asking great questions. Remember that if you have participated in today's webinar, you are able to redeem our offer that you can see on the screen. And please note that our offer is valid until May 17th. If you have more questions for Alex or Rosemary, you can find the contact details in the slide. Thank you so much, everyone, again. I hope you all enjoyed our webinar today, and hopefully we will see you again soon. And also, just one final note, you can download the app for free and try it. And we will keep the slide up for a couple of minutes so you can scan the QR code and download the app. Thank you so much, everyone. Thank you, Rosemary. Thank you, Alex.
Thank you so much for hosting, Eliza.
Thank you.